Well, surprise, your Medicare plan has been changed. I get a lot of people say, I don't want to change my Medicare plan. Stop bothering me about my Medicare plan. You get all kinds of crazy calls out there all the time from Medicare insurance brokers and agents and companies and all the rest of it. They're not supposed to be cold calling you anymore starting October 1st. So if they are, then if you didn't tell them specifically to call you, then they're not supposed to be calling you. So maybe I would probably hang up on people like that if you didn't specifically tell them to call you or you called them first. All right. So what's happening here? So there are four undisputable facts for 2025 for Medicare. Unfortunate. A lot of people aren't getting this information and they're going to be very, very surprised in January. So my job in my semi-retirement, if you're new to my channel, my name is Ed Weir. I ran the third busiest Social Security office in the country, and I've helped millions of people with all things Social Security, retirement, spouse benefits, survivor benefits, Medicare, Medicaid, all the rest of it. And in my semi-retirement, that's what I'm doing. My commitment is to you to make sure you're getting everything you're entitled. This is also a live Q&A. So if you have any specific questions about any of all that, make sure you type it in the chat. I'll talk about all of the craziness of 2025 here. It won't take that long, probably about 10 minutes. And then I'll get into all of your questions. But there are five undisputable facts for 2025. Let me pop them up here. Fact number one is close to 2 million plans, Medicare Advantage, Part D prescription drug plans are being canceled effective December 31st. And you were supposed to receive the letter in the mail. A lot of people don't open that. They don't understand what's going on. They, think it's, just regular Medicare, annoying Medicare insurance companies. So they just throw it away or use it to wrap fish or whatever the case may be. But up to 2 million people are having their plans canceled. And if you had your plan canceled, you better find a new plan, because if you don't, you go into the doctor in January and the doctor is going to hand you a bill and says, hey, here, pay $500, $1,000, $2,000. And you're like, oh, here's my card. I said, no, that canceled December 31st. So a lot of our people are going to be very, very surprised. So please reach out to everybody you know that is receiving Medicare Advantage, Part D prescription drug plan. If you have a Medicare supplement plan, the plan F, G, or N, this doesn't apply to you. If you want to get one of those, stick around for fact number 4, and this might be a perfect opportunity. So anytime there's a little bit of silver lining in all these plans being canceled, but we're talking about that. We'll talk about that. And even the plans, because basically there's been a lot of changes for next year for, the drug plan, the drug prices from 8,000 max to 2,000. So the health insurance companies are trying to save more money so they can buy their CEO a new yacht, whatever the case may be. And so that's why they're canceling all these plans. So everybody that's been canceled, the companies basically said, yeah, we're not making money off of these people. It doesn't look like we're going to make money off these people next year. So bye. Um, so for those people that they can still make money off of next year, they they didn't cancel your plan, but they just might have just downgraded it to where if you actually looked at it and looked at the details, you would probably want to cancel it yourself. And I partnered up with Chapter Medicare. And if you need help, free help reviewing your plan, make sure you reach out to them, tell them Ed said hi, and they'll take care of it. It's 100% free review. They help people throughout the country and they look at every single plan. They'll check your plan, whether it's been canceled, downgraded, give you your other options, and then you decide what you want to do. Okay, so fact number 2 is if you don't review your plan, you just might lost it for January and for the whole year, and then you'll have to run around January and try to figure out what's going to happen. If you don't check it, you're going to lose benefits possibly, depending on how your plan has been downgraded. And a lot of people say, well, it's still zero premium. I still got my doctor. Well, there's a lot more to that. There's how much are you going to pay for your drugs? Did they increase the tiers on your drugs? Did they increase the deductible? Did they increase how much you have to pay per night in a hospital? Did they increase how much for an MRI, for a blood test, whatever the case may be? Those are the things you have to review. And if you don't, then you're going to be stuck with whatever you got next year. Your current plan is just going to roll over, but you think you have a, Corvette, 2024 Corvette Medicare plan in your parking lot, and you wake up January 1st and now it's a 1972 Ford Pinto. So sorry, Pinto lovers out there. But there's another thing these insurance companies are doing. If they cancel your plan, they call it they kind of walk you over to another plan of their choosing. So you might receive another card in the mail and you're like, oh, it's the same company and stuff like that, but it's a completely different plan because a lot of people don't realize that these Medicare insurance companies in your area probably have two, three, four, five, six, seven different plans, and you've got the old Ford Pinto version, and everybody else around you's got the Corvette version, um, or vice versa. So it's important to check that because if they say, "Hey, your plan, you were not making enough money on your particular plan, we're going to switch you over to this other plan without, we'll send you the letter, but you didn't read it. It's too complicated. It's not in real English." And they switch you to another plan of their choosing, and guess what? They don't get to be billion-dollar insurance companies by, oh, now we're going to give you free ice cream and unicorns for life because we're such an awesome company. No, they're gonna downgrade you probably. Fact number three is whatever you do, you obviously have to make sure that if you're in a zero premium plan, you want to make sure you're trying to stay in a zero premium plan for next year. You want to keep the same doctors. You want to save money on prescriptions. You want to focus on your health care, how much for the doctors, how much for MRIs, how much for CT scans. And then obviously, look at all the shiny bells and whistles after that. Dental, that might be your most important thing for next year, or gym membership, or whatever the case may be, transportation. So it might be the same exact company. Again, you're like, I like this company. I don't want to switch. Okay, fine. We'll stay with the same company, but upgrade to the newer plan that they have possibly for 2025, or the one they have this year that they're just re-upping for next year. So you can stay with the same company, same as premium, hopefully, same doctor, hopefully, and then save all kinds of money and get yourself better protected. All right. Fact number four is that there's an opportunity. So to return to original Medicare. So if you have a Medicare Advantage plan and you were canceled, a lot of people out there are like, please cancel me, please cancel me. Why? Because if you're canceled, then you have a guaranteed issue. So if you find that letter that says you're canceled, keep that letter. And on the bottom of it, it'll say, because we canceled you, we kicked you to the curb, you now have a guaranteed issue right to get a Medicare Supplement Plan G or a Plan F. And if that's right for you, there's some people it's not right for. It's a budget issue, and so call Chapter Medicare, and they'll see if you're canceled and whether you have a guaranteed issue to see if they can return you to original Medicare starting January 1st. So you don't have to deal with the prior authorizations and the networks and all the referrals and all that other kind of stuff. So you're going to have, original Part A, Part B, and then a Medicare supplement. And then you also get a Part D standalone prescription drug plan on top of that. So there are a lot of people out there that are hoping they get canceled. That's always unusual. Yes, please cancel me so I can go back to original Medicare. But it is a perfect opportunity. You don't have to go through health underwriting. So if you have pre-existing conditions and you're 78 years old and you said, oh, I should have got a Medicare supplement. I'm tired of these prior authorizations and networks. I should have got a Medicare supplement but I can't now because of my health conditions. Doesn't matter. You've been canceled. You're free. You can get a Plan G, a Plan F, and you're beautiful. So awesome, awesome, awesome. Okay, let's go ahead and get into, I kept that down to 8 minutes. So that wasn't too bad. Let's go ahead and get to all of your questions. Let's see what we got here. So again, if you've got any question, this is on all things Social Security, retirement, survivor benefits, spouse benefits, anything and everything. All right, Madrid, hello, Dr. Weir. Hello, everyone. All right, got a regulars here that always come in and join us and help the community. Let's see, Laura. I'm 62. My husband is 76, both still working full time. My husband has been receiving full benefits for over 10 years. I want to know how I can get the most of his benefits. So if he's currently receiving benefits, once you start your benefits, then you have to file for benefits on his record as well. And so if you're 62, your benefits are going to be reduced because you're filing early. With Social Security, anytime you receive benefits early, retirement benefits, survivor benefits, spouse benefits, they're almost always reduced. There's a exception to the exception with survivor benefits, but um, so if you file for benefits on your own record, it's reduced. If you then file for benefits on your husband's record, then that is reduced as well because once you wait till your full retirement age, both of those are your full benefit amount. So in your particular case, and there's also the annual earnings limit. If you're currently working and making over, 23,000, then Social Security holds back $1 for every $2 you go over that amount. Changes a little bit every year. So in your particular case, yeah, it really depends on that situation, whether you need money. If you need the money, then, that's one of the things. There's also, should you start your benefits? Is there a longevity issue? Are you healthy? Is it going to put you in a higher tax bracket? If you get those extra benefits, do you have any children that need to, receive benefits on your record? So they're just too many variables. So, how will the new administration affects SSI and SSDI? Yeah, I'm gonna punt on this one. Knowing a little bit about history and politics, campaign promises. What are the percentage of campaign promises that actually come true? So if all the campaign promises come true, then it doesn't look good, or may it look good? So yeah, whether I'm going to punt on that one. But I just did a video. I just recorded a video. I'm going to post it up a little bit later today on a bill in Congress that is going to reduce benefits. If it's passed, it's going to reduce benefits for everybody. It's going to increase benefits for a very small percentage of retired government workers. So government workers get a double their paycheck basically, and the rest of us get royally, you know what. So I'll post that later today. So make sure you watch out for it. I signed up for today. If reject my application, then what? Signed up for today. Yeah, not sure. Disability, retirement. Yeah, if any type, Social Security, or you file and you're denied for whatever reason, you have appeal rights. The first one is so you file an initial claim and then a reconsideration, SSA 561. They look at it again. If you disagree with that, then you go to administrative law judge, and then the appeals council in Falls Church, Virginia, and then federal court, and then the Supreme Court. Will I get penalized when I start receiving my pension if I'm collecting disability and survivor benefits? It depends. That's what my other video is on today, is about pensions. It's about one specific type of pension. It's a non-covered pension. So Nadine, if that pension comes from non-covered employment, that is a government job that you did not pay into Social Security, then it could very well affect your benefits. But it comes from any place other than a non-covered, government job, then no, it doesn't affect your benefits at all, because you're just receiving regular survivor and disability benefits. So no. I was a widow at 28. I got married at 44. Does that make me ineligible to receive survivor benefits on my deceased spouse? Yes, because sounds like you're still currently married. You can remarry and continue to receive survivor benefits after the age of 60. So she says she's 66 now. So yes, you're currently married, and you were married before the age of 60. So how much of a bump in added Social Security benefits does someone get for full military service retirement, 20 years? I mean, in addition to yeah. So when you file for benefits, again, number one, please check the earnings record, because that's how everything is determined. And then if you served in the military, the Social Security employee, that's the CS, the claim specialist, will ask you if you ever served in the military, and you might have to show your DD-214, because basically they give you a little bit extra earnings in those years per quarter. And it usually is not a few dollars a month or so, but hey, a few bucks a month, a few bucks a month. So what are you going to do? Chapter Medicare took care of me today. Charles was a great broker to deal with. I was pleased with his advice. Awesome. Good deal. I like it. All right. 100%. I look for, throughout the country, because people, my specialty is Social Security and, Medicare Part A and Part B, but the particular plans, I needed someone that worked the entire country and then actually reviewed all the plans and gave you all your options. And I had a list on a couple of days ago. They also have after service customer service, which most places don't. So if you have a billing issue, or you needed to find another doctor, or you need this or that, or have an issue with it, imaginator. So now you've got a team. We call it the three amigos, the three musketeers, the dream team, three stooges sometime. It's me. I help you with all things Social Security. Thomas, that's who helped you out in terms of finding a new plan and get you in a new plan. And then Alyssa at Chapter, she helps you, make sure you're getting everything you can out of that plan that, after all, you paid for, right? LOL, I own a Ford Pinto, was a disaster. Yeah, I think the issue is you run into the back end, the gas tank was in the very back end, and it, yeah, just exploded, right? Free ice cream and unicorns. Yes, yes. Chevy vegan. Yes. How do I claim income from a business? I started with my former husband. I worked on that business for over 12 years, did not receive a paycheck. Yeah, not sure about that. But I started my crazy journey on YouTube about a year and a half ago. And I was kicking and screaming, no, I'm not doing YouTube. I'm not 20 years old. And I finally did YouTube. But I think one of the very first videos I did was about a situation like this. What happens is, if a husband and wife has a business, accountants often mess this up. When a husband and wife have a business, the accountants know the IRS. So they divide up the income for the IRS and yada, 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 and everything's cool. But they don't do the same thing for Social Security. They put all the Social Security earnings on one Social Security number, one of the spouses. And then if they stay married, then beautiful, everything's good. But if later on something happens and they get divorced, then one spouse leaves, and then they turn 62 and they find out their Social Security benefits are $100 a month, because all of that money went into their other spouse. So if you have a business with someone, and if you're going to stay married, then it might be a good idea to, put it on one, so you get that higher benefit on that one, because you're going to get spouse benefit. But if it turns out not so much, then you need to think about that. I've seen that way, way, way too many times. Yeah, it's unfortunate. I'm so confused. Yeah, well, yes, that's why I'm here. I called the Social Security office about the Medicare Part B from my spouse. He is covered in my familiar family insurance medical plan, but I will going to retire from my work, and he's 64. Okay. All right. So let's see here. So I'll just give, basically, if you have health insurance from current work, yours or your spouse's, and that employer has 20 or more employees, that has to have 20 or more employees. If not, then that's not credible coverage. And sometimes, if whatever plan you're in, they make you sign up for Part A, Part B, and so if that's the issue, then you'll have to deal with that. Or you do have health insurance from work, you're not obligated to sign up for Part B. It's not mandatory, but the health insurance from work is just terrible. So maybe it's a good idea to go ahead and sign up for Part A and Part B, and then find a plan to cover that, either Medicare Supplement or Medicare Advantage. So yeah, if your spouse, family insurance medical plan. So if you're, yeah, so I'm not sure about that. It's just, yeah, is that a plan that has 20 or more employees? If not, then yeah, he has to sign up for Medicare at 65. Chapter and Lottie was so easy to deal with and went over the plans available so completely. Highly recommend, even if staying with the same plan, but I changed. Very happy. Yeah, they said, I think about half the people that contact them, they will find a better plan, and I think probably less than half, probably about 30% of people, they just happen to be in the best plan. So Chapter said, no, you're in the best plan. We'll talk to you next year. So bye. I had a great person at Chapter take care of my needs. Wow, wow, awesome. Thank you for letting me know. Yeah, so my son and I interviewed companies throughout the country, and looks like we made the right decision. So awesome, awesome, awesome. But please, yeah, if you have any issues, please let me know, and I'll get it taken care of. Also, his is covered in my retirement insurance, but they mention a penalty when I read that's not true. Can you clarify? Okay, retirement insurance. So yes, that's not credible. It has to be through current work. So yeah, a retirement insurance plan is not considered current work, but it's your decision. If that retirement insurance company doesn't make him sign up for Part A, Part B, and you're 100% guaranteed, 100% for sure you're going to have that retirement health insurance for forever, and it's not going to be an issue, then that's your decision. But quite often, you have a retirement insurance plan, and then 2 or 3 or 5 years later, whatever, the board of directors and the CEOs decide they want to do a golden parachute, and they take all the money and leave you to fend for yourself, and you no longer have health insurance, and you go back and sign up for Part B, and they say, well, there's a 10% penalty, so you owe us 100% more than everybody else. So, I watched your recent video earlier. Would you explain married over 10 years? If collecting at 62 and X is 59, would I get more from Social Security when he turns 62? It really depends. So, yeah, you had to be married for 10 years or longer. And it doesn't necessarily need to be consecutive. This is what all those social media people out there, they're all pretending that they know Social Security when they've never worked for Social Security and never read the 20,000 pages of the policy and all the exceptions. So 10 years. One of those exceptions, if you remarried the same person. So if you marry them for like 5 years, get divorced, and by the end of the next calendar year, you remarry the same person, Social Security can add, and stay married the second time for at least 5 years. Social Security can add those two times together to equal 10 years. So that's one of the millions of exceptions in Social Security. But okay, if you're 62 years old, you go ahead, if you want to go ahead and file for your benefits, you file for your benefits. And if when that person is it your ex? Yes, your ex. When your ex turns 62 years old, then you can file for benefits on that person's record. And here's another mistake a lot of people make. There's tens of millions, probably hundreds of millions of dollars out there that people aren't collecting. Um, they think they have to wait for their ex to file for Social Security benefits. That is not correct. The ex just has to be 62 years old, and you've been finally divorced from that person for 2 years. It's called independently entitled divorced spouse benefits. So, let's see here. We were dropped his Aetna PPO. So yeah, somebody dropped their PPO. So make sure you call. This is on TikTok here. Make sure you call Chapter Medicare there. The number. If you call my main number on TikTok, if you look on the main screen, you've got my main number, and then just press 1, and you'll be connected directly to them, and they will help you out. How can a person get Social Security benefits from someone when they are already married? When the other spouse is already married, doesn't matter. If your ex remarries, no relevance whatsoever. If your ex is receiving benefits and their new spouse is receiving benefits and their kids are receiving benefits, has no relevance to you whatsoever. If you were married to that person for 10 years, you're entitled to benefits on that person's record. If you yourself are remarried, then no, and you're still married. If you get remarried and then divorced and you're now single, then you can get benefits on a previous spouse's record. Let's see, what other questions? Let's see. Yeah. You got remarried at age 40. Yes. Okay. Somebody jumping in and answered questions there. Perfect. Oh, I signed up with Chapter today. If they reject my app, then what? Reject. So we're not talking about a Medicare Advantage or Part D because they can't reject those. So you signed up for a Medicare Supplement plan. So yeah, if the company, health conditions or something, and you didn't, a specific special enrollment period didn't apply to you, then yeah, Chapter will reach out and say, hey, this particular company, because you have, you had this surgery, you have this particular issue or whatever, they denied you. Or if they deny you, sometimes they'll say, okay, well, we'll deny you at the regular rate, but if you pay us a little bit more every month, then we'll give you a plan. And then, but Chapter will reach out to you and give you your options at that time. They might try another company. Well, let's see if another company will accept you, type thing. Sheila Devil Dog, 100% female vet, Ural Devil Dog, 17-year medical retired educator, Social Security denied, not enough work credits. Yeah, so if you didn't pay into Social Security for the 40 years, 10 years, but remember, even if you didn't pay in it yourself, if you're ever married to anybody, you're currently married or you're divorced spouse or whatever, surviving spouse, and that person did, and you meet the marriage time eligibility requirements, then you can collect benefits on another person's record. Let's see. Thank you so much for keeping us informed. You're welcome. I turned 65 and need to sign up for Medicare. I plan on working about 4 more years. Will this affect my Medicare? So if you're 65 and you're currently working, you don't actually have to sign up for Medicare if you don't want to. A lot of, the mandatory thing. But the exception to that is if you currently have health insurance for work, yours or your spouse's, and 20 or more employees, then you don't have to sign up for Medicare at all, Part A, Part B. Some people go ahead and sign up for Part A because, the monthly premiums zero for most people and provides a little bit extra coverage. So you can sign up for Part A but refuse Part B. So when you sign up for benefits, at Social Security, you can, just say, hey, I just want my money benefits in Part A. That's all. I don't want Part B. Or you can just sign up for Part A, or you can sign up for Part A and Part B and not get your money. So there's many, many variables. People think you have to do this when you do this other thing. And sometimes you do, sometimes you don't. Depends on your particular situation. That's why I do a live Q&A pretty much every day, it seems like. How long after signing up for Part B do I have to get a supplement plan, G or N, without underwriting due to retirement? I'm getting different answers. About 6 months. It really depends on your particular state, but generally 6 months. But legally, but if you have Part B and that's all you have is Part A and Part B, I wouldn't recommend waiting. Because Part A and Part B are awesome, but the big gap is Part B, 20% coinsurance. So if you go to the doctor and get a $100,000 Band-Aid, then you have to cough up $20,000 cash to pay for that Band-Aid. So it's good to get something, a Medicare Supplement, Medicare Advantage, whatever the case may be, whatever is good for you in your particular case. If you're looking to a Medicare Supplement, then those are the ones I recommend first. If it's within your budget, then I would do it. Yeah, because just having Part A and Part B, you're exposed to a lot of financial, risks. We should be grandfathered in, not reduced. Unconscionable. Not sure what we're talking about here. Okay. How do not-for-profit insurance companies make their money? Yeah, so basically, yeah, so if it's a non-for-profit, then whatever money they make, they just don't make a profit and pay shareholders and all the rest of the stuff. Sometimes those non-for-profits are the CEO or the president, and it's like, oh yeah, we don't make a profit. I take everything that's left over. So it's like you got the CEO or something, and the nonprofit, and it's like making $2 million a year, and but there's no profits after that because the CEO takes all the money. So yeah, it's when you're super rich like that, you can afford all of those fancy lawyers and accountants. Unfortunately, that marriage lasted only 4 years. So remember, people think that surviving spouse, you also have to be married 10 years. No, that's not correct. If you're divorced, then yes, 10 years. But if you were married to a particular person when they passed away, as long as you were married to that person for at least 9 months, and there's a couple exceptions there too, 9 months, then you're good. You can collect surviving spouse benefits. Thank you, Dr. Weir and Deb. This information has helped me. Perfect. There we go. All right. I like this platform. This information is really needed. Yes, I agree. That's why, yeah, when I didn't think it would take off as much as it did, but I should have known because, when people used to come to Social Security, Social Security does a terrible job of informing people of all their, their benefits available to them. And, Social Security employees, would like to spend more time, but, they've got another 400 cases on their desk they have to work in that particular day. And so, yeah, so basically when you go into Social Security, you already know what you have to know already before you walk in there what you're entitled to and what you need. Because Social Security, they can't give you kind of, strategic advice or anything like that. It shouldn't be like that. And it's going to get a lot worse, a lot worse. Yeah, I guarantee that. But I will still be here. Melody, I will be 66 in 8 months, January 18th, married 25 years. My social security will only be 500 something. How do I get my husband's part that brings me up to hear of him? Forgot what you called it. We are still married. Spouse benefits. But because you're still married, he has to file for benefits first. So when he files for benefits, then you can file for benefits on his record. And because you're full retirement age, you'll get 50% of his full benefit amount minus your own. Yours is offset. Um, so yeah, just regular spouse benefits on yours, but he has to file. I need to find a naturopath. Which insurance company has them? It really depends on your particular area. So reach out to chapter and you just tell them your zip code and tell them, whatever doctor. And they'll try to find a doctor that takes that. And hopefully that doctor takes Medicare because the doctor has to take Medicare to begin with. Yep. My wife is 64. She was a stay-home mom with no credits. Should she draw her spousal benefits at age 65 rather than wait till her full retirement age 67? Yeah, that's a decision. You have to file for benefits on your own record first. So hopefully you're already receiving benefits. So if you're receiving benefits, then she can file for benefits on your record. So it really depends on your particular situation whether you want to file early or wait till your full retirement age. You know, so I would run the numbers, call up Social Security, set up an appointment so you can get the definitive numbers. If you go onto my Social Security, you can get kind of guesstimates. But if you want 100% perfect numbers, then you schedule an appointment and say, hey, for your wife, your wife files a claim for spouse benefits, and they will tell you, effective this month, you're going to get $1,237. If you wait until whenever, you'll get, $1,475. And then you say, okay, that's this much of a difference. Let's say it's a $50 difference, for instance, but you're going to get $10,000 ahead of the game if you start your benefits now. So you take that 10,000 divided by $50, and it usually comes out to like 14-year break-even point. So yeah, it really depends on your particular situation, her health, or family longevity, whether you need the money, um, bunch of other questions. So. Today, my spouse benefits was denied. They say my Social Security is already half of his. Okay, yeah. So the spouse your benefits have to be less than your spouse. But remember, Lola, this because you said half, that means you're filing on a spouse or divorced spouse or whatever, and that person is still alive and kicking. But if anything should ever happen to that person, then that half thing doesn't apply anymore. Survivor benefits, you can get up to 100%. So that's another thing we see a lot of people missing money is they're told by Social Security that, yeah, you're not entitled to benefits on this person's record. And what the Social Security employee should say, they should finish that sentence and say, you're not entitled to benefits on this person's record today. However, if anything should ever happen to them in the future, then you would potentially be eligible for benefits. Again, in that case, their benefits have to be at least $1 more than yours. So, can we get our benefits and spouses' benefits together? Absolutely. Yep. All day long. I was talking to Terry and all the rest. Yeah. Lola Lucky. Yes. You have to get benefits on your own record, but you can't there's a technical thing. You're going to get both checks, but one offsets the other. You're going to get the higher of the two minus your own. So if your spouse is getting 2,000 and you're getting 1,000, you'll continue to get your $1,000. And if you're entitled to the 2,000, then you're going to get your 1,000 plus another 1,000, which equals 2,000. So you're getting both, but one offsets the other. A lot of people, particularly on survivor benefits, they don't realize that, and they think they're going to get both checks when their spouse survives. And that was always a very, very tough conversation where I had to tell the person that, yeah, you're going to be losing, $1,000 in the household every month because your spouse passed away. And they say, I thought I received both checks. Well, you kind of do, but one offsets the other. And yeah, it's usually not a good conversation. So 38 years married. He doesn't want to pay any alimony. So alimony, child and support with Social Security. there are a lot of cases where, you get a judgment, a court order to pay alimony or child support or whatever the case may be, and then the spouse, whoever, ex-spouse, um, you know, doesn't have any income, or they work under the table or whatever the case may be, they never pay up. When that person starts to get benefits, Social Security benefits, now they're getting federal benefits. So you can garnish those wages. So you go back to the court and say, hey, my ex is now getting Social Security, and the court will send the garnishment order directly to that Social Security office, and the Social Security office will garnish those wages according to whatever the court order dictates. We used to get those every single day. You can't take those down yourself, because in our office, we have had several times where people brought the court orders, and we looked at it and it's like, well, we actually just received this court order directly from the court. And according to that one, it says you're going to get $370 a month, but on yours it says 1,370. Where'd this one come from? So yeah, we don't trust Social Security. They have to get it directly from the court. Sneaky, sneaky, sneaky. If still married, can a spouse apply for their spouse's Social Security when they reach 62? Yes, for your current spouse, absolutely. But you have to file for benefits on your record, and that person has to be receiving benefits as well. My hubby was disabled at 57. I'm 4 years older, and at 62, I got mine, and only 6% of his, less than 130. Yeah, so you did the right thing. And started to receive the benefits. So let's see here. I received the cancellation letter for the Medicare Advantage plan. I am looking to enroll in another Advantage plan equivalent to what I had. Who would I speak with providers to be in new plan? Yeah, reach out to Chapter, and they will go through all your options. And remember, because you were canceled, you have the option now to at least kick around, whether a Medicare supplement plan is right for you, the G or the F. If it's not in your budget, but at least you've considered it. If you're actually sick, if you're, have issues, then, even with the monthly premium for the Medicare supplement plan, if you have to go to the doctor a lot, then, it might be cheaper just to, pay that monthly premium. Because the Medicare Advantage plans, sure, they're zero premium, but they're pay as you go. So if you actually get sick, then you pay. With like a Part G plan, you pay the monthly premium, and then let's say there's $1 million therapy that you have to go through. You pay $240, and you just walk away and let Medicare and your whatever insurance company you chose pay the other $999,900, whatever it is. So yeah, reach out to Chapter and they'll help you out. Have you heard about the $2,700 allowance for any senior on Medicare? Yeah, these bait and switch, clickbait, false advertising. These are they really got to stop this. Center for Medicare and Medicaid Services changed the law on this, the regulation, and basically what it is you've got these not great people out there that find one of these. So somewhere in the country, there's a supplemental plan or a Medicare Advantage. These are always Medicare Advantage plans that have a food card or a flex card or something for $2,700. So they find one in the country, and then they advertise it. This company or this person advertise it to everybody in the country, and you call them in and say, hey, I want that $2,700. And they say, well, do you live in Tampa, Florida? No, I don't. Oh, sorry, you don't have it. Oh, I live in Tampa, Florida. Okay, you live in Tampa, Florida, but do you have Medicare and Medicaid? No, I don't have Medicare and Medicaid. Well, you can't get it. And then they try the hard sell, but they already got you to call, and then they're never going to stop calling you and bugging you. And if you hang up on them, they've got your information now, so they'll sell it to everybody else, and everybody else will call you. And yeah, they really need to stop it. So anyway, now that the presidential and Senate have been decided, what is your best guess on possible impact of Social Security and Medicare going forward? I'm gonna jury is out. I have my personal beliefs, but y'all don't care about my personal beliefs. I'm just the old Adam 12 was just the facts, man. I'm just gonna, if something comes up, I'm gonna watch everything like a hawk. The video I did, I'm gonna release later today, talks about the very first thing that happened on election day. I'll talk about that, but everything else, I'm only going to talk about it when it actually happens. So, or it looks like it's going to happen. You are a breath of fresh air to the people, Dr. Weir. Thank you. You're welcome. Thank you. I appreciate that. I enjoy hearing from Dr. Weir. We all need your help to help others. Yes. And remember, this is a team effort. Imaginator and Cadillac Jack and Bonnie and everybody, Melody, Penelope, everybody out there. If it's just me sitting here blabbing on for an hour and answering your question, it helps you all, but it doesn't help anybody else. Please share and subscribe and what's the other, like, and all that other kind of good stuff. And that way it gets out to more people and more people get the help and you're paying it forward. And yeah, hopefully in some of your community will, your family or friends will thank you for it. Be a superhero. Finally got through to the guy working on my Social Security benefits. Wow. It's been weeks and nothing. He says he needs help from his super with filing retro Social Security. Survivor is supposed to start now, but can't file yet. Okay. All right. So, wow. Not sure what he needs help with. The supervisors, probably his technical experts, usually supervisors. Yeah. Can't really. Anyway. Yeah. Sounds like you got somebody new. Yeah. That's pretty easy to do the adjudication on something like that. But yeah, but at least you got told hold of someone. So I guess that's a start. Great information. Thank you for helping us. You're welcome. Thank you. Thank you. Thank you. Phyllis, my brother was under the table for most of his work life. He received about $700 monthly. Can he apply for Medicaid? Yeah, absolutely. Yes, please help him out. So I love these. I love these. My brother, my sister, my uncle. Please, yes, I like this. If none of this applies to you, I guarantee there's someone around you like your brother. So thank you, Phyllis, for looking out for your brother there. Yes. So call the Department of Social Services, Department of Welfare, whatever in your state. Before I worked for Social Security, I worked for Department of Social Services doing Medicaid. But reach out to them and have your brother reach out to them and file for Medicaid. It is a welfare-based program, so low income, low resources. If all he's receiving is $700 from Social Security, then that's definitely low income. So that's good there. So definitely apply for Medicaid. And if he is receiving Medicare, you can receive Medicaid, and Medicare. It's too many people miss that. And if you're receiving Medicaid can actually pay, if they're willing to do it, pay for your Part B premium, the $174 or so. So that'll put another $174 in his pocket. And if he has Medicaid and Medicare and the correct levels of Medicaid, he can also get one of those Medicare Advantage dual eligible plans. Those are the ones that, if there's, I guess there's some place in the country that has a $2,700 grocery card. Those are the ones that have the best, the more bells and whistles and all the rest of it. So what if you were in a common law marriage for 14 years and married for 1 year, then your spouse? So it really depends. Social Security has to go by the rules, the laws in that particular state. So I would file for benefits. I'd reach out, if you're 62 years old or 60 or whatever the case may be, so for survivor benefits, I would reach out to Social Security and file a claim and tell them that common law marriage. And in the Social Security policy, that 20,000 pages of policy, POMS they call it, it has every state that has common law, and it has all the regulations and what documents you need and how long and everything. So just reach out, file a claim, and then the Social Security employee will go through all the process and tell you exactly what you need. So Susan, to switch from a Medicare Advantage back to traditional Medicare, do I call Medicare directly or the broker helped us with the Advantage plan? You don't call Medicare directly. They can't help you with that. You have to call a broker that, if you want to use the one that helped you, originally you can, or you can reach out to Chapter and they can do it just as well. And then you get, awesome after service and they look at all the plans in your area. So yeah, you just call them up. And if you don't have a special enrollment or something like that, then you'll have to go through health underwriting. And there's some states where you don't have to go through health underwriting, but Chapter, they are licensed and contracted in every single state, so they can help you out. Can you sign up for Part B on the Social Security website? For Part B, if you're past 65, They just started this thing where you can put in the documents online. But yeah, if you're just signing up for Part A, Part B, yes, you can do that online. Yep, absolutely. Gina Maria, I have a card with $250 on it, and I have no idea what I can use it for. Just called the number, and it's, oh my gosh, disconnected. That's another reason, a little icing on the cake, the cherry on top of chapter why I chose them. My son and I chose them is because they also have these are computer super nerds, the people that run this company, and they've just designed this over the counter system that helps you use all those benefits. And so it's pretty awesome. I think it's the only one in the country. So reach out to them. Again, see if they can find you something and see if they can help you out. It's just, yeah, this new over the counter application that they come up with. So yeah, it's pretty awesome. Would Trump stop the SSDI and SSI only income finances? Yeah, again, I'm just the facts, man. How long do I have to wait? I asked to speak to the supervisor. Nope. Call the main number and get a more experienced agent. Nope. How do I get through? Then it's time to, if you're running into a brick wall, then go on to your political representative's website, your congressperson, senator, and there's a little button there that says, I need help with a federal agency. Click that button, type in your information, and that'll light a fire under everybody. So. Lisa, my 19-year-old grandson with autism is applying for SSI. We have a call with Social Security scheduled for 11/12. Do you know what questions they will be asking? Yeah, they'll just ask basically the disability. So you're basically filing for retirement. They'll get the name, and you might have to probably have to provide the birth certificate. Maybe not if he was born in the United States and everything is correct. And they'll say, okay, you're currently working, married, and they'll ask all the disability type questions. Have you ever worked? When's the last time you worked? What is your disability? What doctors are you seeing? Get the names of the doctors and everything, and the phone numbers for the doctors. And then I did a series of videos on filing for disability, and maybe watch those, and it'll give you all the insider tips, tricks, and secrets on how to get everything set up well. So yeah, and then yeah, good luck. Hopefully it works out. I did a video specifically on autism. For Autism Oklahoma, they reached out to me and wanted me to do one for disabled children and disabled adult children. So I did one for them, and it's published up there. But yeah, definitely. So yeah, great help that you're helping them out. So hopefully everything works out well. Janet, I will turn 65 next month. I was married for 17 years before a spouse passed away 25 years ago, remarried for only 4 years, and then divorced. What do I do concerning spousal benefits? I work full time. All right, so you work. Let's start from the end and work my way up here. You work full time, and you're 65. So if you have health insurance from work, current work, and your employer has 20 or more employees, you don't have to worry about Medicare. You're good for Medicare. If you're, unless your company makes you sign up for Medicare or whatever. And if you're working and making over 23,000, then Social Security is going to hold back $1 for every $2 you go over. So it might not be a good idea to file for benefits if you're, if everything's going to be withheld, but it really depends on how much you're making. Once you hit your full retirement age, then you can make all the money you want. So maybe it might be, depends on your work, it might be a good idea to just go ahead and hold off, right? Please take the time to give Ed a like. Yes. Free valuable information. Yes, please like. That way it gets out to more people. All right. I started drawing survivors benefits at 60. Will my benefits ever change to Social Security? Well, survivor benefits is Social Security. But if you take your benefits early like that, then if you're reduced and you continue to get your check, you'll always be reduced. But remember, if you took survivor benefits and you didn't touch your own benefits on your own record will continue to increase. So maybe at your full retirement age or 70 or whatever the case may be, your benefits on your own record might be more than your survivor benefits. And at that time, then you switch to your own. Let's see. I signed up for SSD and said was denied for SSI because I get a check from a long term. Yeah. So Social Security employees need to do a better job explaining that. When you file for disability, Social Security always addresses both programs, SSDI and SSI. And if you're getting any other money or your SSDI is basically over $943 or you have any money in the bank, they will automatically deny your SSI because SSI is a welfare-based benefit. And you file, and then like a week later you receive a denial letter in the mail, and people always freak out. Oh my gosh, these dirty rats, they denied me already. See, if Social Security denies everybody the first time, that's how that crazy internet myth has started, which is 100% incorrect. Stop that. SSI, you were just denied for SSI, the welfare-based benefit. And your SSDI, your Social Security Disability Insurance, hopefully that, that continues and they send it up and, do the medical determination, all that. But the Social Security employee should tell you, hey, you're going to receive a letter in about a week denying your SSI. It'll stay on the top, supplemental security income. Don't worry about that. That's because you have, $3,000 in the bank, or you get a pension, or your Social Security disability benefits or more. So yeah, they just need to explain a little bit more. I had an appointment on September 18th for IDS and nothing. I'm still on hold. What should I do? On September 18th? That's not right. So, so you had an appointment, and did you actually do the claim online? That is, did they ask you all the questions and, request the documentation in terms of, marriage certificate and divorce decree and all that kind of stuff? But yeah, that's been what, 2 months now. That doesn't sound right. But did they actually take the claim? If they took the claim, 2 months to adjudicate it is way, way too long. That only takes, a few days to adjudicate something like that. So I'm not sure what's going on. They lost it. Yeah. Based on my decades of experience doing this, running the third busiest office in the country, they dropped your ball. They dropped the ball. I would reach out to them and say, hey, what's going on here? So if I take spouse to court for garnishment of unpaid alimony, could pay for the court costs since he is violating court order. Yeah, you have to talk to an attorney on that one. Let's see. Lori, what is the 240 deductible for Part B for each occurrence, or a one in a year change? It's once a year. Yeah, thank you for that question. Yeah, once a year. The deductible for a hospital, when you go into hospital, you pay the first $1,632. That could be several times a year. So if you go in the hospital, for 3 or 4 nights, you pay the first $1,632, and then if a couple of months later you go into a hospital again, it could be another $1,632. But the Part B is a one time. Supplemental plans are expensive, but I had to have 2 rounds of expensive IV infusions and never paid a penny. Saved tens of thousands of dollars, or wouldn't have gotten treatment needed at all. Yes, if you are healthy and you intend on being healthy and never falling or never have an accident for the rest of your life, then 100% I would get a Medicare Advantage, pay 0 premium, and use all that extra money to, go to Hawaii every year, whatever the case may be. But what do they say? Life is what happens while you're making other plans, right? So if you actually get sick, then, everybody I've talked to has said, oh, it's a good thing I had a supplement because it covered everything. I didn't have to pay out of pocket for this, that, and the other. And I didn't have to worry about delays and denials and prior authorizations and networks and all that other kind of stuff. So, again, I wish more people could afford. I wish if everybody got a Medicare supplement, then the Medicare supplement plans would be very, very low. Well, what I wish, if I was dictator for a day, I would get rid of all the Medicare Advantage and Medicare supplements and all that, and make original Part A and Part B no gaps. So there would be no gaps in Part A and Part B. So you wouldn't need a Medicare Advantage or a Medicare supplement. But yeah, if I was a dictator for a day. But all my regular viewers know that would be my second dictatorial decision. My first would be the cure for male pattern baldness. So sorry, I've got my priorities. Receive the new card with letter stating if I have a Medigap policy that includes a Part D coverage, I must contact my Medigap insurer to let them know I have joined a new Part D. Is this true? Never had to. Wow. I'm not sure about that one. Yeah, I would yeah, I'm not sure why they don't care. A Medigap policy, yeah, they don't care about drug coverage. You call them up. But okay, here's a cautionary tale. When because the same companies that sell the Medicare supplement plans, 90% of 99% of them also sell Medicare Advantage plans. And I hate to break the news to you, they make more money with Medicare Advantage. Everybody makes more money generally. Agents, brokers, and everybody makes more money with Medicare Advantage. It's counterintuitive. You're like, it's zero premium plan. Nobody makes money on a zero premium plan. People, Ed's pushing Medicare Supplement because there's a monthly charge or premium. And that's why, no, everybody makes more money with a Medicare Advantage plan. So if you're on a Medicare Supplement plan or a Part D plan, you're still going to be harassed. And it just might be from the Medicare Supplement plan that you have now, because because you are their client, so they have the authority to call you whenever they want, because you are a current client. And they'll, hey, we're just checking up on you, making sure your plan is okay. How's everything? Oh, did you know that we have a new plan in your area with, dental and vision and gym membership, and it's a zero premium, and it's so awesome. And it's going to be with the same company, with us right now. Do you want to go ahead and switch? And then you wake up and one day now you no longer have a Medicare Supplement plan, you have a Medicare Advantage plan. So please be careful of that. So I'm thinking that might be something there. Yes, that might be that. So like, and heart, I like it. I got a letter from SSA saying my Medicare Part A and B will be 174.7. Yep. Actually, it's just your B. Your Part A is 0. Can you please talk about Social Security benefits when someone is retiring with minor kids? Yes. If you are receiving benefits, retirement benefits, or disability benefits, and you have children under the age of 18, those children are potentially eligible for benefits on your record, up to 50%. If you have a spouse that is staying home to take care of those children under the age of 16, that spouse can also get benefits on your record. So, and it doesn't affect your benefit, doesn't reduce your benefit. There is a family max that there's a maximum that could be paid out to the whole immediate family. Yeah, when you filed for retirement benefits or disability benefits, the Social Security employee should have asked you that. That's part of the application process. Do you have any children under the age of 18? Do you have any children that became disabled before the age of 22? And if you tell them that, then they should say, okay, well, let's go ahead. So can I get more from Social Security now that disability benefits exhausted? Disability benefits never exhaust. Maybe what you're talking about is when you're on Social Security disability and you turn your full retirement age, then Social Security disability benefits are automatically switched to regular retirement benefits. So it's the same dollar amount. So benefit amount won't increase because of that, because you're on regular retirement. But you're no longer going to have any limitations. When you're on disability, there's all kinds of limitations and work and everything like that. But now that you're on regular retirement and you're your full retirement age, you can make $1 billion a month and it doesn't matter. And you no longer have any, those CDRs, the continuing disability reviews or anything. So it's a beautiful thing. All right, let's see what else. I am 62 and not feeling healthy. Do I get Social Security or SSDA? Or you're probably SSDI. So yeah, if you're 62 years old, here's an option. You can file a RIB-DIB. A RIB is retirement insurance benefits and DIB is a disability insurance benefit. So if you're 62, here's the reason you think about filing for both. If you go ahead and you're disabled, your disability, your condition prevents you from working substantially over $1,550. You're not able to work, so you file for disability. Okay, perfect. But if you're also happen to be at least 62 and knowing that the Social Security disability application is going to take 6 to 9 months at least to make a decision, it depends, some are approved the same day if you've got, terminal illness, cancer or something. But normally 6 to 9 months. And you just can't wait 6 or 9 months for money to come in. You need money now. That's when people say, okay, I'll go ahead and file for disability and I'll go ahead and file for my early retirement as well. So at least I can get a check coming in while I wait for my disability to be approved. And that's called a RIB-DIB. But one thing is, If you start receiving your retirement benefits early and then later they approve your disability, it depends when your disability is approved, but they might reduce it a little bit based on 1 or 2 or 3 months that you took your early retirement benefits. So yes, it's called a rib dib. Let's see here. Can you get SSDI, retirement, and independently entitled divorce benefits all at the same time? Um, you can get two of the three. You can get SSDI, Social Security Disability Insurance, and you can't get your retirement at the same time because you know you're getting disability. But if you're getting disability and you're also entitled to those independently entitled divorce spouse benefits, then yes, you can get those. One offsets the other. So again, if you're entitled to $1,000 from your spouse and you're receiving 700 from disability, you'll continue to receive the 700 and then receive the difference, $300, for a total of $1,000. But pink hibiscus, there are way, way, way too many people out there that are receiving disability and they don't want to file for spouse benefits or surviving spouse benefits or whatever, because they think that will stop their disability. And if their disability stops, their Medicare will stop. That is incorrect. You can get disability and continue to get your Medicare and get surviving spouse benefits and all the rest of it. So please, we need to go out there. There's a lot of people suffering out there, struggling, and they have money available to them, but they don't know they do. So let's go out there and help them out. All right, we are over an hour, so let's make this our last question. In Arizona, to qualify for Medicaid, you can't receive more than 1,200 in income. Should I move back to Nevada where I had Medicare and Medicaid? Yeah, some states are very, very cheap, and Arizona has some weird, that you can only apply this time of the year and something like that. So yeah, Medicaid, even though it's a state federal partnership, the states have a lot of latitude on how much. Some states count your Social Security benefits, some states don't. Yeah, I've had someone that was in Nevada and they were getting Medicaid and they moved to North Carolina, and North Carolina says, nope, we're going to count your Social Security disability insurance. And Nevada didn't. So yeah, it's state. And then if you remember, if you move to another state or another area, then if you have a Medicare Advantage, remember you have to change your Medicare plan. And that's an opportunity. You can do that any time of the year if you move and stuff like that. If you lose your Medicaid, you can change your plan. If you have Medicaid, you can change your plan several times a year as well. So, um, all right. All right. That'll do it for today. If I didn't get to your question, I apologize. We're out of time, but I will be back again tomorrow. And please cut and paste your question, save it for tomorrow, pop it in first thing, and I will get to it first thing tomorrow. Y'all have a beautiful